Good evening. Imagine, if you will, you're out on the streets. You're lonely, you're hurting, you're homeless, you're hungry. Of course, there are services for that. There are services that provide for all of your needs and all of your problems. You have a problem, there's a solution. You become a case, you become a client, you become a patient. There are lots of questions, lots of forms to fill out, very clinical. The other end of the spectrum is a much more compassionate approach. One that treats you not just as your problem, but goes beyond that and looks at you as a whole person, as a human being, a compassionate way of seeing you. And I've seen services provided here in Peterborough from a wide range, from one end of the spectrum to the other, from the totally clinical to the totally compassionate. And while there are important aspects of the clinical process that need to be followed, without the compassionate approach, I believe that there isn't the holistic, sustainable services and responses that are given to people to be more effective in the outcomes. And so my research is focused on the need for and how to motivate individuals to provide those more holistic health and social services, from the clinical to the compassionate. And I did that by, first of all, identifying that spirituality was one of the important factors that might motivate people, but quickly recognizing that other factors such as faith, compassion, wellness, religion, community, wholeness, and culture also were important. I also recognized that my own definitions of these might affect the results of my research. And so I looked for people to provide me with input in terms of definitions, in terms of alternatives and words that might mean these things to different people. And so I looked for people within my research scope who came from an indigenous, religious, and other spiritual perspective in providing social and health services. And I asked them to give me these words, which they did, and I've introduced those into my research survey, where the people who are responding with their own definitions, given the words I provided, which I then asked them to use to define how they motivate themselves in terms of providing more compassionate services. And I also asked them what other factors are there that they use to be more practical in providing those services. And I also asked them, are there any other things that restrict you from providing those services in a more holistic, in a more compassionate way? And with that, I am using the outcome of my research to provide information and resources to organizations within Peterborough so that they can provide a more holistic perspective to their own research, to their own services, and to ensure that, as Aristotle said, that they are judged fairly as a nation by the way we treat our most valuable citizens. Thank you very much.